Hello everyone, I hope you're having a great Sunday morning. I'm just taking a walk this morning and I thought I would review a topic that I think is critically important, and that is about recovery from eyelid surgery and expectations and reality and reducing anxiety. So what do I mean by all that? I get asked all the time by patients after surgery, is this normal? Should I be worried, etc. I think reducing anxiety after surgery is important. I think how we think about ourselves after surgery changes chemicals released in our bodies, etc., and can affect healing. So I wanted to go over some realities about recovery from surgery. Remember that patient happiness equals a simple formula. It equals reality minus expectations. So if expectations are not in line with reality, then it's very, very difficult to be happy. So let's talk about expectations. So I'm going to talk about the most common things I get asked about. There are things I won't cover, but these are the most common. The first is asymmetries. So someone has their upper lids done and afterwards they're asymmetric, and it's 2 weeks out, 3 weeks out, etc. I think these are things that iron themselves out over time. One eye does not always heal like the other. They could look different easily for 2 to 3 months and sometimes up to 6 months. It tends to settle. Father time is a great healer, and over time these things tend to settle and become more equal. So I think it's really important not to get over worried and create too much anxiety over asymmetries that exist between the two eyes in the early post-op period, and again up to 6 months. Unless they're gross, huge asymmetries, that's a different issue. Swelling. Swelling after surgery, I tell most patients that bruising and swelling lasts, the significant amount, 3 weeks or so. They're back in the gym afterwards in full activities. But minor amounts of swelling can exist for months, usually worse in the morning, less as the day goes on. And swelling is not a terrible thing or a terrible complication. It's a normal human body response to the trauma of having surgery. Remember, surgery is trauma. Just like an injury is trauma, it's just controlled trauma. So swelling is normal. And again, it can be asymmetric between the two eyes, which is very, very normal. So again, give it time. With a number of months, it tends to settle. 6 months is another time frame for me that I look at it where I don't get too overly concerned. What about scarring of the upper lids after surgery? Well, everyone heals differently. In upper lid surgery, an incision is made in the natural crease. Sometimes if there's a lot of skin hanging beyond the corner of the eyelid, you have to raise the brow to get that skin out of the way. If you don't raise the brow, you have to extend the incision. A small scar may be noted. This is something you talk to people about beforehand, decide whether or not they want to add brow lifting to the surgery. At about 2 weeks after surgery, I have patients put a scar cream over the incision. It's important they stay out of the sun because the sun can darken the incision, theoretically can make the scarring worse. The scar creams are usually over-the-counter scar creams that are silicone-based. Some of them also are based in allantoin, a certain compound, onion bulb, etc. And then there are some that are a little fancier that have more ingredients in them. Skinuva, for instance, is a common type also. I usually have people start at 2 weeks out. I like Mederma. It's over-the-counter and it's simple. It comes in a cream and a gel. I like people using the cream and the bedtime cream because it has a moisturizer in it. But scarring, again, is something you look at over time. Most of these things go away and are not that noticeable. Scarring usually due to the thickness of the skin and the tension on the closure. The eyelids have thin skin with little tension. The other thing that people talk about after surgery that concerns them has to do with whether if they had ptosis repair. Remember, ptosis is different than extra skin on the eyelid. It's when the eyelid margin, where the lashes are, is lower, so the opening of the eyelid is less. When you perform a ptosis repair, you change the mechanics and dynamics of the eyelid, as opposed to a blepharoplasty, where you're just taking skin and muscle and fat out. When you change the dynamics of the eyelid, it's a little more complicated of a procedure, much more specialty of a procedure, and should really only be performed by people who are very used to doing this kind of surgery. So in ptosis repair, I've seen asymmetries last 6 months very, very often. Again, most of them tend to settle over time. If they don't, then you do some adjustments, most of them just done in the office. Those are probably the most common things I get asked on the upper lid. What about the lower lid? Well, on the lower lid, swelling is another common one I'm asked about. If you're just taking fat out of the lower lid, just going inside the lower lid and taking some fat out, swelling is very minimal. The negative to that is when you do that procedure, it could easily hollow out an eyelid. I tend to take the fat in the eyelid and transpose it to the hollow below. When you take native eyelid fat, natural fat in that location, and shift it to the hollow below, it's a more traumatic procedure. And as I said, surgical trauma leads to swelling. So the swelling can persist longer. A month is very, very normal, if not longer. Also, that fat pedicle that you transpose can feel a little hard for a while. It's not unusual. For 6 weeks on average, sometimes you don't see it, but you can feel it, a hard area where the hollow is that you've transposed the fat. That's totally normal. If that hard area persists, it can be injected with some anti-inflammatory drugs to soften it. I rarely do that unless someone is very anxious, because that's a normal part of healing. Also, that fat pedicle that's transposed is moved to a lower location to fill the hollow. Oftentimes you'll see that the hollow is filled, but above the hollow, right over the bone here, it can still feel prominent. Not even hard, but prominent. Why does that occur? Well, the natural fat is draped over the lower lid bone to fill the hollow. And sometimes that draped area that goes over the bone gets a little inflamed. Again, that settles over time. Remember, Father Time is a great healer. If fillers were injected into the eyelids or cheek, I look at the eyelids and cheek as one unit. I don't care when they were injected. 5 years ago, 10 years ago, 15 years ago, people are under the impression that when fillers are injected, if hyaluronidase is given, they disappear and they're gone. That is not true. Portions of filler can remain for a very, very long time. Filler is a nidus, or a substance in that area that collects fluid. So if people are having persistent fluid or persistent inflammation, the healing phase gets slowed down a lot. And I tell anyone who's had filler, there's the potential for prolonged swelling and prolonged recovery. Sometimes the filler needs to be injected with hyaluronidase again. Sometimes people don't like hyaluronidase. You have to wait it out. Sometimes oral steroids are used. But when there's any unusual form of healing with swelling and fluid retention, today, in my mind, it's old filler till proven otherwise. I'm not saying fillers are wrong. I'm just saying fillers can cause some of these problems after surgery. There's now been published papers on eyelid surgery after filler. We have to be very, very careful about fillers and eyelid surgery. The other thing I'm asked about a lot is something called chemosis. That's C-H, not K, chemosis. And it's swelling over the surface of the eye. The skin over the white part of the eye can bubble forward. It looks like a yellow jelly substance. What that is the lymphatics and drainage of fluid out of the eye get affected by surgery. It's a long discussion on its own. We can talk about that sometime. This is usually managed by massaging the lower eyelid up, placing eye drops in the eye, sometimes a temporary stitch from the lower to the upper eyelid, and sometimes things that are more involved. These things are mostly mild. I rarely see severe cases. They go away over time. And again, not something to be overly concerned about. It's a normal part of healing. It occurs in probably 8 to 10% of patients that have lower eyelid surgery. So while it's concerning to you, talk to the doctor about it, talk to your surgeon, and you'll find that most of these things go away. Finally, when you transpose fat, take the native eyelid fat from the eyelid and shift it into the hollow below. There's a minority of patients where that transposed fat can pop back and look like an eyelid bag again. If the fat is filling the hollow, then it probably hasn't popped back, because the fat's in the hollow. Probably the stalk of fat over the bone is inflamed. But if the hollow isn't filled at all, it can retract and pop back. This just happens in a small percentage of patients. Remember, everyone's an individual. Healing is individualistic too. When this happens, it can be managed by whittling that fat down again surgically. So I hope this helps. Just some common things to expect after eyelid surgery. Have a great day.